Dental hygiene and periodontal disease are a very commonly commoditized aspect of dentistry where people are just coming in every 6 months because that's what insurance covers and not necessarily being given enough time to really deal with the underlying issues. So having your gums bleed, while a lot of people think it's normal, it's definitely not normal. Your gums should not be bleeding when you floss or brush. It's not because you're flossing too hard or you're pressing too hard on the tooth. It's actually a sign of inflammation in the gums. It's a sign of gum disease when you have bleeding gums. The blood or the swelling that occurs, it's an inflammatory reaction of your body to the bacteria that are present in your gums. And it's not just about a risk of you losing that tooth in the future. What's more important is right now, because your gums are bleeding, your capillaries are all wide open, and those bacteria are getting into your bloodstream and they're affecting all these different body systems that you have, and they have been linked in research to over 60 different conditions in your body, whether it's diabetes, heart disease, Alzheimer's, pregnancy complications, a lot of things that are really common in the population. Certain conditions, for example, where you have your immune system weakened, such as cancer, even people will need to have dental clearance to be able to undergo treatment or undergo surgery. But even if your immune system is strong, it doesn't mean that you need to ignore these issues. So if we have patients coming in where their condition has not been corrected, where the gums continue to bleed despite them coming in regularly, it's important to create a customized periodontal program for them. We need to also do some additional testing. We typically will take a saliva sample to evaluate the species of bacteria that are in their mouth, if there's anything specifically tenacious, as well as their immune factors. And then based on those tests, we can create that customized program and target specific antibiotics potentially to help manage that disease.